This preview of the lecture video on the topic Propagation of Ultrasound, Signs and Artifacts, part 2 of the lecture video. Short clippings of the various parts of the lecture video will follow. Having gone through the preview, if you wish to listen to the main lecture video, go to sonoshare.in. Due to the edge effect, this is called the edge shadow. See here, even in the BPD, when you are taking the BPD head, you get shadowed through, gets reflected, so you get a good image here. But at the edge, you see the angle of insonation, it gets refracted. So this is explained here. Now this is the beam coming, and here the interface is perpendicular to the beam. So that is that will be represented nicely. That's called a specular reflection. So nice reflection. Whereas here the reflector is at an hepatic vein, whichever way the wall is perpendicular to the beam is seen well. You see the portal vein view, you see that the interventricular septum, there is a false defect, ventricular septal defect, that is the dropout. So to do muscle, you see it is echogenic, and you see measure it to diagnose HPS. Now the pyloric muscle appears echogenic. Now if you take a section like that, cross section, the same pyloric. So, and if you see the interfaces of the muscle, circular muscle, it is perpendicular to the beam. So as a result, it will be echogenic. The interfaces are seen well, so it appears echogenic. Anisotropy, so you must be aware of this. Another example in the anal sphincter. But we know that above the diaphragm there is lung containing gas, so you cannot get a hemangioma there. The echoes come back. Again the echo is reflected by the mirror to reach the probe. Okay, but the probe does not know that the beam has been reflected. Then from the hemangioma, again the echo goes back and goes to the transducer, but the machine does not know the tracheal wall, that is the cartilages. So deep to the gas in the trachea, we get the mirror image. Another fetus which also shows movement. So why is it? This is an artifact because of the which acts as a mirror, you get deep to the skull. So this is again an artifact. You don't get vessel aorta, the IVC. Anterior to the aorta, you see the superior mesenteric artery. But by the side, you see another aorta and another superior mesenteric artery. Refraction happens. So part of the beam goes straight and part of the beam gets refracted. Okay, so this is refraction of ultrasound. So this is the ghost of aorta and superior mesenteric artery. How to prevent it? So this bowel gas produces this artifactual calculus here. So how does it produce? That is because of the side lobes. So that information it will put in the straight line within the beam. So that we will see to the side lobes of the beam. It's called side lobe is broken. So the diaphragm will not be broken. So this is an artifact. So why it produces, and is it by this what we speed of 1450 meters per second. So it is slower. So because of the slower, the beam will take more time, is it not, to reach the diaphragm. So this is put within the gallery. In sagittal, it looks as though there is a calculus. So this is an artifact because of the beam width. So the machine assumes that the beam is thin like paper, and the beam passes through part of the cyst and part of the normal organ here. Suppose if it's liver, normal liver and the cyst. As a result, both the information will be put on the image, transverse section, axial section. Through that, you see that it is the gallbladder which looks normal, but it is the duodenum which is impinging on that. So when you use scan, you see that it is not a thrombus, it is the IVC. There is actually a hemangioma in this part of artifact is aliasing. So what is aliasing? You see in the center of the flow, you see a opposite color. Now this is an color, there is no color to represent that velocity. So as a result, it goes back, wraps around and puts blue. It can be flow reversal. So here it is flow reversal in an aneurysm. So in an aneurysm, what happens? There is circular flow. So there is reversal of flow. Whereas here it is aliasing, like that. And then it has to go out through the same vessel. So it has to come back. So it swirls back. So it takes a circular flow. It flow reverse angle. So here this is the linear, this is the vessel. You have used 90 degrees. So there is color box is on, but you don't see any flow in the vessel. It doesn't mean that there is no flow. So other artifacts are mirroring, which we have already seen, the hemangium of the scalp, and then color bruit. When the velocity is very high, then similar to the short path reverberation or the comet tail in grayscale. So you see the comet tail here in grayscale, but when you put color, you get the twinkle artifact because of the enlarged prostate with calcifications on the surface, which produces the twinkle artifact. Okay, thank you.